I'd like to introduce our next speaker, Associate Professor Dr. Barbara de Courton. Barbara is a general physician and National Heart Foundation Future Leader Fellow with extensive experience in clinical research, epidemiology and public health in the area of non-communicable chronic diseases. So Barbara's vision, which I think is a great one, is to establish new strategies for the prevention and management of chronic diseases, in particular obesity, diabetes and cardiovascular disease. Her goal is that her research findings translate into treatment guidelines, reduce diabetes and cardiovascular morbidity and mortality, and reduced healthcare costs. So please join me in welcoming Barbara, who's talking on carnosine in chronic diseases.
Thank you, Kylie. Thank you for inviting me. So we switch a little bit topics. After very interesting Kevin's talk, I'll be talking about one of the food supplements we're using currently in research, and hope that you spread the news and send us a lot of participants for our research trials. But I'll show you a little bit of the evidence and how and on what we work. So the talk will be about carnosine and chronic diseases, and in particular, role in prevention and treatment of cardiometabolic risk factors and diseases. So this is the outline of my talk. I will briefly mention what's the focus of my research group, then talk about burden and risk factors of type 2 diabetes and cardiovascular disease, and then what is the current evidence for carnosine, in particular animal studies and some of the human studies which are out there, and what our current research projects are on. So focus of my team and myself has been identifying and providing evidence for interventions which are safe, low cost, easily scalable and applicable for several chronic diseases, and have a potential for immediate public health impact, so can be translated into population interventions. So these are my students and my two postdocs and my research assistant. And this is where we do research at Monash Translational Precinct, which is state-of-the-art facility for both clinical research and laboratory research. So burden and risk factors for type 2 diabetes. As you know, 60% of adult Australians suffer from overweight and obesity, and about 25% over the age of 25 have pre-diabetes and diabetes, so it is a big problem. And if you have obesity and diabetes, 80% of these people will have cardiovascular disease, and this amounts to huge annual healthcare costs. Type 2 diabetes is a funny disease. It actually has a lot of different risk factors, not only obesity, but also hypertension, dyslipidemia, and a lot of others. And they're actually shared not only between diabetes and cardiovascular disease, which is the main two diseases which are related to each other. We know that diabetes promotes is a very strong causal factor of cardiovascular diseases. But they are shared actually with other chronic diseases such as dementia, depression, cancer, and general aging. What is important is that there is a long latency before the disease develops from a risk factor. And therefore, we have actually a lot of time to prevent these diseases. And in my mind, what is the ideal preventative strategy is the one which prevents multiple risk factors and therefore diseases, and which impacts on the mechanisms of the diseases. And we have actually such interventions already, and some of them are diet, exercise, but also metformin. And if the intervention can be synergistic with exercise, then I think we're on, or lifestyle intervention in general, I think we're on a winning track. So this is just a pictorial form of what I just said. These are some of the causes of chronic diseases or type 2 diabetes and cardiovascular diseases. And these are some of the risk factors of diabetes and cardiovascular diseases caused by these causes here. But as I mentioned, these risk factors and the causal factors are actually not only common for diabetes and cardiovascular disease, but also for dementia, cancer, aging. And some of the mechanisms which I have been focusing on researching is inflammation, advanced glycation, and oxidative stress. So why carnosine? Carnosine has been in animal studies associated with pretty much all chronic diseases, meaning supplementation with carnosine has been shown to prevent most chronic diseases. And this comes mostly from animal studies. What is carnosine? Carnosine is actually present in meat and fish, and it is a dipeptide which is synthesized by carnosine synthase and hydrolyzed by carnosinase, and that produces equilibrium. It is a naturally occurring dipeptide. It's present mostly in cardiac and skeletal muscle, but also brain tissue. And it first appeared about a decade ago as a food supplement and in skin creams, and is actually advertised as elixir of youth. Yet at the time when it was advertised, so it actually had very little human research. Carnosine is water soluble. It's safe. The doses used in current clinical research are 0.5 to 3.5 grams, and it's fairly low cost. And some of these properties like water solubility and safety actually would make it easy to use for population interventions because it could be mixed with food. Some of the important effects of carnosine which have been described in animal studies are lowering of chronic low-grade inflammation, oxidative stress, and advanced glycation. But also there are several studies in animals which show that carnosine can prevent some of the damage caused by ischemia. So for example, if you get a stroke or if you have a heart attack, if you pre-treat these animals with carnosine, the defect which is produced by ischemia is actually, when you don't get enough blood, the defect is actually much smaller, 30 to 50%. And also it lowers sympathetic nervous system activity, which might or might not be of benefit, according to what Kevin was saying. So what is the evidence in animal studies? So carnosine in animal studies was shown to reduce weight, insulin levels and insulin resistance, which Kevin was talking about, and delay development of diabetes in mice, but also lower glucose levels in mice who had already type 2 diabetes. And it was shown also to reduce inflammation and oxidative stress. And for cardiovascular disease, carnosine was shown to reduce cholesterol and triglycerides, and also reduce some of the processes which are such as oxidation and glycation of your LDL cholesterol, which are important for atherosclerosis. And as I mentioned, also anti-ischemic effects. Nice music. So what is the evidence in humans? So most of the evidence actually in humans comes from exercise physiology. Carnosine is used to increase exercise capacity in sports people and has been used for probably 10 years now. And there is even a meta-analysis, so combined research where they show that the pooled effects are in fact there. The mechanisms are a muscle buffering capacity, it lowers lactate, and it also improves calcium handling. We've reviewed some of the studies which were done with carnosine, and most of the evidence actually comes, as I said, from exercise physiology. I'll mention our study in obesity, overweight and obesity. There is one heart failure study and a whole lot of studies in cognition and depression. So this is one of our studies where we showed in a pilot trial with 30 people that 12-week intervention with carnosine improved insulin sensitivity and insulin secretion, so it had positive effects on risk factors of diabetes. And even more so, what we found that those who already had impaired glucose metabolism, so people who already were on the way to get diabetes, had an effect on after glucose challenge on glucose and insulin. these are some of the results of the combined data from our meta-analysis, which is currently underway. So after we published our trial, several other research groups started to do research in this area. And what they found was, or what we're finding with diabetes, HbA1c is a 3-monthly average we measure in patients with diabetes. And we found that these combined results from all of the studies produced 0.5% decrease in HbA1c, which is about what some of our weaker diabetes medications do. And also there was a modest effect on triglycerides and on CRP, which is an inflammatory marker many of you might be familiar with. So the gaps in the evidence currently are that all of these studies which I presented use different doses. They were actually done in different populations. There were some studies in overweight and obese individuals, some were in type 1 diabetes, and some were in type 2 diabetes. And also, 2 of the studies used mixed supplements, so there was carnosine with something else. And that's always tricky when things are combined because you don't know what actually has an effect. And also there was a lack of gold standard measurements for risk factors of diabetes, such as insulin sensitivity and secretion. So in summary, from the current literature which is available, we know that carnosine is a food supplement. It seems to be safe. It's water soluble, easy to mix in foods. It has the right properties, at least the animal studies and some of the preliminary human studies show that it has anti-inflammatory, antioxidative effects and lowers advanced glycation end products as well, and has positive effects on sympathetic nervous system. These effects are all very important for many chronic diseases. There may be an additive effect with exercise, and this could be due to that carnosine actually improves exercise capacity. There is very compelling evidence from animals and paucity still of human data. However, it's increasing. And there is a need for well-designed trials. And if proven beneficial, carnosine could be used for primary prevention in many chronic diseases, as well as an add-on therapy to standard therapy for diabetes. So I just briefly mentioned what we're doing in this space currently, other than the meta-analysis, which is on its way, which one of my PhD students is working on. We have 2 trials which are currently going on. One is in overweight and obese individuals, and the other one is in patients with impaired glucose metabolism, so either impaired glucose tolerance and/or diabetes. And we're looking at diabetes risk factors, we're looking at cardiovascular risk factors, and we're looking also at cognitive parameters, because there is some evidence that patients with diabetes have actually cognitive impairment, even though mild. We're looking at if we can target some of these mechanisms as well, such as inflammation, oxidative stress, and advanced glycation. So we're recruiting currently 84 overweight and obese individuals and 52 patients with impaired glucose tolerance and diabetes. The intervention is a double-blind controlled trial, which is the gold standard for clinical trials. We use 2 grams of carnosine or matching placebo, and the intervention is 14 weeks long, and we do measurements before and after. I'll skip through these inclusion and exclusion criteria, maybe just briefly, that the people who we're recruiting are between 18 to 60 for overweight study, and they can be up to 70 for diabetic study. And for the diabetic study, they can be on metformin but nothing else. And these are some of the outcomes we're measuring. These more for the scientists in the room. So we're looking at obesity, and we're measuring percent body fat. We're looking at liver as well. We're looking at fat in the calf. and diet and exercise. Then we're looking at insulin sensitivity and secretion by cold standard measurements. We're looking also at kidneys, cardiovascular parameters and cognition, and a whole lot of these mechanistic things which will tell us how actually carnosine works. So just to come back to my previous slide, so these are the diseases, risk factors, and causes. These are the mechanisms down here, and the hope is that carnosine would sit somewhere here and potentially could prevent several chronic diseases at once, yet to be proven. So I'll finish there. I hope it didn't go too much over your head. I wasn't sure about the audience, how much. I thought maybe there's more of a split between practitioners and lay public, but I'm happy to take any questions at the end. Thank you.